Good morning, students. Let's continue with National Tuberculosis Control Program. So, initially we told about National Tuberculosis Control Program and saying more about District TB Program and District TB Center working as a nucleus of this District TB Program. Coming to why this National Tuberculosis Program become failure and we have to initiate this revised program. So these are the reasons called to be a lacunae why we have initiated a new program. So reasons was completion rate of the treatment was only 30%, inadequate budgetary outlay, shortage and irregular supply of anti-tuberculosis drugs, undue emphasis on X-ray diagnosis, poor quality of sputum microscopy, more emphasis on case detection rather than cure, poor organizational setup and support, multiplicity of treatment regimens, poor awareness of TB patients about the disease, non-availability of trained staff. Lot of lacunae were there in this National Tuberculosis Control Program. So we were more focusing on case detection rather than cure aspect. Thereby the treatment was not followed up correctly. Thereby more number of drug-resistant TB was arised and TB drugs was in irregular supply was there. So again that was the reason before drug resistant TB initiation and lot other reasons we have seen. So these are the called to be the lacunae why we have failed with National Tuberculosis Control Program. So we have initiated new program under this that is called as Rntcp. Now presently we are in a phase 2 of this Rntcp. So this Rntcp program is 100% centrally sponsored program, free of cost of diagnosis and treatment with anti-tuberculosis drugs. 13,000 plus microscopic centers are there to diagnose the cases as early as possible. 4 lakh plus DOTS treatment centers are there. So not only we have identified all the lacunae, keeping in mind we have resolved all these lacunae, not only the case detection but we are more focused on treatment follow-up, regular supply of the medicines, etc. Thereby we have started lot many microscopic centers in every blocks, lot many DOTS treatment centers. Thereby these all issues are being solved. And we have started with another scheme that is called as Stop TB Strategy. It started in 2006 till 2015, started by WHO, and vision is a world free of TB. And the goal is to dramatically reduce 50% of the global burden of TB by 2015 in line with Millennium Development Goals. So that was the aim, to reduce the minimum of 50% of global burden of TB. As in line with MDG, we are working for that. Sixth goal is combat HIV, malaria and other diseases. So that is another target of this Stop TB strategy, because TB is becoming an common opportunistic infection of HIV. So this also become a target of this strategy. So under this strategy, main components are pursuing high quality DOTS expansion and enhancement. We told direct observation treatment course. So in front of the health provider, the victim has to take the medicines, that is known as DOTS. You might have learned about the DOTS, what DOTS is and what is TB, about the disease aspect in your second year. So DOTS is nothing but it in front of the or under the supervision of a health worker or a DOTS provider, the victim has to take the medicine. Thereby, the regular medication intake will be there, follow-up will be there, adherence to the medication will be there. Thereby, we can reduce the drug resistance among the patients affected. Addressing TB, HIV, MDR, TB and other challenges, contributing to health system strengthening. So, in all the health centers, wherever this TB program is being running, sufficient training and provisions are being provided for the better implementation of the program. Engaging all care providers, empowering people with TB and the communities, enabling and promoting research. Similarly, stigma and discrimination is another issue. To prevent that, more and more awareness is made among the public about the disease, and thereby lot of discrimination has been reduced among the disease, and lot many researches has been also started in relation to TB to prevent and to have a better preventive aspects. Coming to again back to Rntcp, what are the main objectives of this Rntcp? That is to achieve 85% cure rate for newly diagnosed sputum smear positive patients, TB patients. So we are expecting 85% of cure by regular treatment of DOTS. To detect at least 70% of new smear positive cases, because more microscopic centers has been established, thereby we could able to have a case detection properly. We are giving advertisement in all the mass medias saying about more than 2 weeks of cough with weight loss and other signs and symptoms, you can suspect of TB and immediately come for checkup. So in that way, this kind of advertisement is given in all mass medias, thereby people are more aware about the disease signs and symptoms and they are coming voluntarily to have checked for the positivity or not. Involvement of NGOs, IEC and research in all the activities, thereby preventive aspects and control aspects are working better. Coming to the organization pattern of this system is that initially starting with state TB office, that is state TB officer is the head under the state TB program, and under that we have state TB training and demonstration center, that is headed by the director, followed by district TB center. In that TB officer, district TB officer is responsible, and under that we have a TB unit which is being headed by medical officer, senior treatment officer and senior TB lab officers. Followed by we have various microscopic centers, treatment centers. Under that grassroots level there is a GRAS providers who is providing the medications for the patients. Coming to different strategies under this, first one is augmentation of organizational support at the center and state level for meaningful coordination. So every level we have a good and systematic organization pattern. Accordingly, all the services, as it is centrally sponsored program, central level, state level, a good organization is there, thereby the activities are being running very well. Increase in budgetary outlay, we have a good budget outlay for the implementation of the activities. Use of sputum microscopy as a primary method of diagnosis among self-reporting patients. So sputum microscopy, as we have seen in the last slide, more number of sputum microscopy centers have been initiated. Standardized treatment regimen, we have DOT centers also initiated in different areas. Thereby regular supply of medicine is there at all the times. Seventh point, augmentation of peripheral level supervision through creation of sub-district supervisory unit. So in all the level there is a supervision properly done. So proper surveillance is being done for proper implementation of the program, ensuring a regular uninterrupted supply of the drugs up to most peripheral level. So in all the level, from the topmost level till the lowest level, everywhere the medicine supply is regular and there is no interruption of this supply. Thereby we are expecting and preventing drug resistant TB, because that is a major issue. Once the patient is being diagnosed with drug resistant, it is very difficult to manage the patient. So to prevent this drug resistant TB, we are trying to solve all the issues by putting DROTs provided, putting regular supply of medicines and IEC activities, operational research and NGO involvement in all the programs. Core elements coming under phase 1. Core element of Rntcp in phase 1, that is from 1997 to 2006, was to ensure high quality DOTS expansion in the country, addressing 5 primary components of DOT strategy. So these are the 5 primary components of DOT strategy. Study well these 5 components, that is political and administrative commitment, good quality diagnosis through sputum microscopy, directly observed treatment, systematic monitoring and accountability, addressing stop TB strategy under Rntcp. So these are the 5 strategies. Political and administrative commitment for regular supply of the budget and medications. We are having a good strong political support for the implementation of this program, and we have microscopic centers and focusing and ensuring that good quality diagnosis is being done in all these microscopic centers. Directly observed treatment, these DOTS facilities are being provided well. Systematic monitoring and accountability throughout the surveillance is being done, and the stop TB strategy is undergoing very well under this Rntcp.